all well, that's for sure. So we all know why we're here today. I know Minister has lots to tell us, and we have lots of questions for us. So with that, Minister, the floor is yours for 5 minutes.
Merci beaucoup, Monsieur le Président.
Thank you very much, Mr. Chair. Honourable members, our public health care system, as you know, is a great source of pride, and it's a pillar of our Canadian identity. I'm pleased to speak to you today about Supplementary Estimate C. The initiatives discussed today include the following: $400,000 to support the National Hemovigilance Consensus Conference, $4.2 million for the Thunderbird Partnership Foundation to distribute naloxone to Indigenous communities, transfers from Health Canada to support chemical management activities and work related to the World Health Organization's Food Additives Expert Committee, $1.5 million for an awareness and prevention campaign on the increase in measles cases in Canada.
Before answering your questions on Sub-C, let me say a few words about one initiative that is currently underway. When we talk about health in this country, we cannot leave anyone behind. La santé et la santé mentale des garçons et des hommes.
The health and mental health of boys and men requires our attention.
Not only improve their lives, but strengthens families, communities, and workplaces to positively impact all Canadians. That's why last month we launched a national conversation on men and boys' health. The input we'll gather will shape Canada's first men and boys' health strategy to be released later in 2026. I would like to invite everyone to join in on this important conversation by visiting the canada.ca/healthymen. And I am grateful of the conversation I had with many of you. Thank you for your support. I also want to provide a brief update to this committee about the toxic drug crisis. While the numbers show that overdose deaths have been going down, it is essential that we continue the fight against the toxic drug crisis. And if we want to build Canada strong, we must confront the toxic drug crisis together. That starts with ensuring communities have the resources they need to support people in ways that reflect their lived realities. Through the Emergency Treatment Fund, our government is providing urgent support to communities on the front line of this crisis. Since October 2025, we announced 35 new projects for $35 million in Ontario alone. And we recently announced 29 new projects in Western Canada, including many Indigenous-led projects. New projects funded under the 2025 call for proposals are set to begin in the coming weeks. And just yesterday, we announced permanent controls for 5 fentanyl precursors chemicals. Every community is different, and there are no one-size-fits-all. Our job is to listen to local communities, work with provinces and territories, and respond. En investissant maintenant, nous pouvons faire en sorte.
By investing now, we can make sure that we support a strong and prosperous Canada for many years to come. It's about protecting Canadians. It's about building a strong Canada. Thank you. I am ready for your questions.
I am chair, and I'm doing chair's prerogative again. I'm going to ask the first round of questions. We're in their first round, and it's going to be for 6 minutes, and away I go. So, Minister, a peer-reviewed study published this week in the Addiction Journal found that after a supervised consumption site closed, deaths did not increase. Are you aware of that finding, yes or no?
Excuse me, Chair, can you please repeat your question?
Sure. A peer-reviewed study published this week in the Addiction Journal found that after a supervised consumption site closed, deaths did not increase. And are you aware of that finding? Yes or no?
Thank you for your question. And I know yesterday I already answered this question and I will repeat it to the committee. Donc, comme je l'ai dit hier, vous savez,
As I said yesterday, as you know, there are many studies
Holy crap, my
about
ears.
drug addiction.
In Canada. So are you aware of this study and its finding? Yes or no?
vous
were not?
Vous me l'avez parlé hier et je l'ai
Yes, you asked that question to me yesterday as well. And what I'd like to say is that, yes, this study, we know that it exists, but there are others with other different results.
Finding that actually, once they closed the site, deaths did not increase. Are you aware of that finding?
Écoutez, de toute façon, ce que
Well,
je veux...
listen, what I will say is that whether these consumption sites are open or closed, the connection with the number of deaths is not proven in this study or others.
Guess not aware of the finding, I guess. Minister, the same study found statistically significant increase in people using life-saving addiction treatment after the site is closed, meaning more people got treatment when the consumption site actually shut down. So are you aware of that finding, Minister? Yes or no?
Je vous ai déjà expliqué que dans la crise des
As I've
drogues,
already explained, in the toxic drug crisis, there is not a single solution, one single solution. There are many solutions, and I constantly work with the people who are.
Madam Mr. Chair.
Yes, hello.
Point of
Let
order.
Minister speak, because this is not yes or no. Let Minister speak. We want to hear the answer too. Thank you.
So I take it again, you're not aware of that finding.
Point
Minister,
of order. Can we just let the minister finish? Some of these questions you may frame it as yes or no, but really needs time to explain. If you can let her just explain, that would be great, because I think the whole committee deserves to
Ms.
hear
Chi-
the answer. Thank you.
you actually interrupted
That's
the
not a
minister
point of
while she
order.
was talking, so I guess I wasn't. I was trying to get an answer out of her, and you interrupted her answering. So that is. I'm fine. We're having a great conversation here, and I'm sure the minister is quite capable of answering her questions for her department. So, Minister, if closing an injection site gets more people into treatment and doesn't increase deaths, will you commit to pausing consumption site approvals while your department reviews this new evidence?
écoutez, comme je l'ai déjà dit,
As I've already said many times, and I'm going to underline the same position as long as I'm in this job, there is no single magic solution. We're looking into all solutions, and I work very closely with our partners from the provinces and territories, as you know. So I do not open these sites, these supervised consumption sites. It's up to the provinces to fund these sites, and there are organizations in the provinces funding them. I provide the exemptions.
It's under
vous me laissez pas terminer.
56.1.
Vous ne me laissez pas terminer.
under the substance
Vous m'avez
use-
posé une question.
You asked me a question. I'm trying to give you an answer.
Me laissez
Point of order.
terminer
Point of order. Can we take
ma
turns? Because I think
réponse.
it's also difficult for the translator to catch up on the.
Vous me posez une
Please,
question, mais
thank you.
laissez-moi vous répondre.
How about we go on to another question? Minister, you are responsible for approving or rejecting supervised consumption sites under the Controlled Substance Act. You agree with that? You're nodding your head.
Oui,
That's agreement, right?
oui.
Since 2015, Canada received 230 applications for supervised drug consumption sites. Of the 230, do you know how many were rejected?
Kendall, I will turn to Kendall. I was not there.
Sorry, I don't have the. We did provide a written response, and so I think that has been tabled. I can try and find it quickly
Yeah,
right now, but I think you have it. It was provided following the last meeting. Some of them were submitted, some of them were withdrawn, some of
So
them.
I have the answer here. The answer is one. Your department has rejected one supervised consumption site out of 230, Minister. One. So have you ever rejected a supervised consumption site as minister? Yes or no?
Ben, écoutez, les décisions.
Well, the decisions are made by the department. I haven't had to approve or reject anything.
Department, not you.
Non, non, je vous dis que depuis que je suis là, je n'ai pas eu.
No, I'm saying is that since I've been in this job, I haven't been in a position to approve or reject a demand, a request. These requests have already been ongoing. So what I will say, and maybe you're not willing to accept this answer, but we work with the provinces and territories. They are in charge of providing these services.
Point of order, you're over
I
time.
have a question. I'm
Point
on
of
the
order,
floor.
you're over time, Mr. Chair.
No, I'm not.
Yeah, you're at 6:22.
Is injecting fentanyl safe, Minister? Yes or no?
Objection. Point of order. It is now 6 minutes and 30 seconds since you started
Point
asking
of order.
questions.
Point of order. Chair,
31 over? No, 31's left.
point of order. Chair, I have a question.
Yes, ma'am.
When there is a point of order, does the clock stop?
Yes.
Thank you.
So I reject. Yes. So the question is, Minister, is injecting fentanyl safe? Yes or no?
Je vous dirais que les centres de consommation supervisés.
I would say that the supervised consumption sites save lives. They save lives. I know, but these I have seen these sites myself in Vancouver. I saw the ambulances come.
Injecting fentanyl, was that safe?
Je
Was
peux pas vous dire que
injecting
c'était
fentanyl safe?
injection de
Was
fentanyl
injecting-
particulièrement. Je n'ai
That's
pas
it.
assisté à ce genre
I'm over.
d'éjection.
Thank you very much. Ms. Chi, you're next for 6 minutes.
Thank you, Minister, and thank you to the officials for attending today. I really appreciate your time. Minister, we are seeing artificial intelligence being increasingly integrated into healthcare, from medical imaging and clinical decision support tools to drug discovery and population health analysis. These technologies have the potential to transform how care is delivered across our health system. And from your perspective, what are the most promising ways that health AI can improve care for patients while also supporting healthcare providers in their day-to-day work?
Oh, écoutez, depuis que je fais mes tournées à travers le pays et que je vais.
Well, I've been visiting many hospitals and companies who are putting artificial intelligence to good use. It's quite developed in healthcare. And despite the challenges that we are seeing, of course, we're talking about the healthcare system that is under pressure. But within a short period of time, within maybe a couple of years' time, there will be great changes in the healthcare system because AI will come in as a tool, which is what I've always said, come in to help us solve or rather close gaps that exist because we don't have enough staff or because in some cases the technology is not up to snuff in some places. When I was in Saskatchewan and I visited this organization, they had mobile instruments that they were sending in the northern parts of the province, and they were providing telemedicine type services. It was extraordinary. So I do think that AI will have a role to play in all of this. Recently, I was in Brampton. I saw robots that are being used in operations. There are some that are being used at the Jean Talon Hospital in Montreal and I think the General Hospital in Toronto. So we are seeing the developments of this technology, and we are seeing that they will come in handy in our healthcare system.
And last 2 weeks ago, there was an announcement on cancer prevention research, which is very exciting. My mom is a cancer survivor, and I think a lot of us know, loved ones or friends or family who are going through treatments. We know prevention is one of the most powerful tools that we have in health policy, and the number is actually pretty staggering. 40% are preventable, and investments in research can dramatically improve outcome for Canadians. And the $41 million investment to support cancer prevention research across Canada through CIHR and other partner organizations was announced. Can you speak to why prevention is so important and how investments like this build or help build a healthier Canada while also strengthening our research ecosystem?
Écoutez, j'ai fait l'annonce et je vous dirai.
We made an announcement, and we had a survivor who was there with us, and they talked about the impact of this kind of research on their life. We keep hearing that we react in some areas of our healthcare system, but in terms of research, specifically, the Canadian Institutes of Health Research is doing great research, is being very proactive in terms of research into cancer, into prevention, into coming up with the cutting-edge technologies and techniques with the best teams in order to lighten the burden, if you will, of cancer on individuals and on families. And the funds we have provided, I hope, will have a big impact. Mr. Hébert is here from the Canadian Institutes of Health Research. He can talk to you about some of the details of these projects. I think we have 19 projects. We have now funded 19 projects with that pot of money.
And I want to also ask you about the national conversation on the well-being of men and boys. It's, recognizing the growing concerns about mental health, social isolation, and access to services. Could you explain why the conversation is so important at this juncture, and how the health portfolio can help improve mental health outcomes for men and boys across the country?
Merci beaucoup pour la question. D'ailleurs, je n'ai parlé dans mon discours.
Thank you very much for the question. I referred to this briefly in my opening remarks. It's an important topic for me for a very simple reason. When I took over this job, I heard from many people about what's at stake when it comes to men's and boys' health and mental health. So the conversation was really substantial, and it was coming from everywhere. So I thought we should look into this. So I reached out to my counterparts in the provinces, who confirmed to me, indeed, that there are concerns in this domain. Is that it? Okay.
Time is up. You're good? Okay. Thank you. Mr. Blanchette-Jonca.
Merci beaucoup, Monsieur le Président. Vous êtes bon, là.
Thank you very much, Mr. Chair. That was good. Minister, hello. Welcome. Minister, my first question is the following. Who made the decision to cap the lab expenditures that was announced in October? Was it your department? Who made the decision to establish the amounts? Yes, because there were some changes made to lab fees on October 17th. Well, I will need to check, but we had some consultations with dentists. Could you respond to us in writing, please? Yes, thank you. Is there an internal analysis that justifies this, the adjustment? Could you provide it to the committee as well? Yes, we can send you definitely the information that we used. Minister, Before these changes were made, did the department assess the impact on patients who already had received prior authorization for a treatment? October 17, 2025, the Canada Dental Plan changed lab fees, the cap on lab fees. Well, the prices were excessively high. I think there were meetings between dentists associations, Sun Life, and the department. So the decision was made to reduce the maximum amounts. Well, we're just trying to understand. So if you can respond in writing. What I'd like to also know is the following. How many patients were impacted according to your analysis, if you did any analysis? So, Minister, next question. Among the 300,000 Canadians, this is from the information you provided to us yesterday, who had eligibility letters for the Canada Dental Plan, do you know how many of them lost their coverage? So during the last committee meeting, we were told that a lot of people received non-eligibility letters and their status then changed. So you're now confirming to us that it's 300,000 people. So I'd like to know, of the 300,000 people, how many in total lost their coverage? Can the department please provide this detailed information to the committee? We just want to know. Yes, we can provide the information. Yes, thank you. A more simple question to you, Minister. Do you know the percentage of dental clinics in Canada currently participating in the Canada Dental Health Plan? 98%. 98. Yes, okay, that's good. Does the government consider that this participation level is sufficient to offer health the necessary services? Well, 98% for a program that was launched relatively recently, having 98% of dental professionals, dentists, and all the others. That's good. I think that is satisfying. People are telling us that their clinics are part of the program, but they cannot get appointments. So of the 98%, how many of these resources actually have appointments available within reasonable timelines? Well, the program exists. People have access to services. And if you have your dentist, you already have a dentist, great. If you are in the market for one, well, that's also another option. But dentists, I mean, we have about 7 million people who have access to the Canadian Dental Care Plan. Maybe some clinics are busier than others. That is why we also have training programs. We're providing funds to have more dental health professionals, because we will need more and more. Sure. On another topic, Minister, before closing the laboratory of the Canadian Food Inspection Agency in Longueuil, did the department carry out a risk analysis? I will turn to my department officials.
Thank you, Mr. Chair, for the question. While we did vacate our space within the Longueuil lab, the tests that are conducted at those labs have been shifted to other laboratories that we have. So there's no risks or impacts with the closure of the Longueuil lab. And I'll also add that I understand that current tenants, which is actually Health Canada, will be taking over that space.
Okay. Donc, je poursuis vers vous. Est-ce qu'il y a eu des analyses?
Okay, I'll continue with you then. Did you do prior internal analysis before this decision was made to close the center?
I would say the analysis was we looked at what types of tests were being done at that facility, and there was no introduction of any food safety or public health issues. So I would say the answer is yes to that question.
Alors, pouvez-vous nous transmettre au comité l'ensemble des
Could you
documents?
provide the entirety of the documents and analysis to the committee concerning the closure of this facility? Thank you.
that round. Okay, Mr. Bailey, for 5 minutes.
Minister, because I didn't understand or get the full answer to my colleague's question, I'd like to re-ask it again. Is injecting fentanyl safe?
I'll help you. It's not.
Thank you, Mr.
The question is for the minister. Thank you.
President, for the question. I believe.
Je vais encore vous répéter que les centres
Well, I will repeat my prior answer and say that the supervised consumption sites save lives. But the federal government doesn't offer any services in these centers, at these sites. It's up to the provinces to do that.
I was trying to go about it in a nice way, but when I saw this core report, now, as you know, I'm from Red Deer. Red Deer shut down the opioid injection site. They paired it with another site that was still open, and they did this study. Have you literally gone through this study? Has your department seen it? I did bring copies if anyone would like one. This injection site decimated Red Deer's downtown. The damage that it did to Red Deer over the last 10 years has changed the way that Red Deer people walk around. And my point is, the Alberta recovery model is working so well in Alberta. Will the federal government look at this model and start to implement it in other provinces? You're shaking your head. Is that a yes or a no?
I'm listening to you.
Okay, so with this study telling you that opioid injection sites are not doing what everyone says they should, and I can give you examples if you like, but I'm not sure if you've read it or not. Will you look at the Alberta recovery model and start to implement it in other provinces by shutting down opioid sites?
Écoutez, oui, je connais le modèle de la.
Well, listen, I'm familiar with the model in Alberta, but it's Alberta's model. It's not the federal government's model. And as I've already said, at the last federal, provincial, territorial ministers meeting, we made the decision to share best practices. Best practices from all provinces are shared with every other province. So the decision about treatment lies with the provinces.
The government are not going to give the provinces any direction. They are on their own. And it's evident that drug consumption sites are not only making communities worse, they're making Canadians suffer from addiction worse. And I'd like to know, why does the government keep promoting this when evidence shows they don't help Canadians break free from addiction? And as my colleague pointed out, you do have the power to close these sites. Why wouldn't you be advising the provinces that this is the direction we're going? We're not going to enable anymore. We're going to focus on recovery.
Comme je l'ai déjà dit plusieurs fois, je pense
As I've already said many times, prevention and saving lives, and of course focusing on treatments, is what we want to do. You are talking about one study, and I'm really going to take a close look at it. The department will analyze it as well. But I've also seen studies recently that show that the supervised consumption sites can save lives.
Two identical communities like this study that is here, and that's what's so unique about it. 100,000 people in Red Deer, 100,000 in Lethbridge. Same types of people. There is a lot more to this study than just saying you can compare it to the United States. Minister, do you believe that Canadians who are struggling with drug addiction should visit safe consumption sites to continue using illegal drugs or be treated for their addiction? So I'm asking, should we continue to enable or should we be looking at recovery? Just a straight yes or no. Enable or recovery?
Écoutez, on a des programmes qui supportent.
Well, listen, we have programs that support everything. So not everyone is at the same stage in this. To go towards treatment, people need to be ready. If they're not ready for treatment, well, we still need to save their lives. So one doesn't exclude the other. And of course, I'd like to see people getting treated. I mean, can you imagine a Minister of Health not wishing this?
Alberta recovery model, because the first thing that I've learned about recovery is you cannot enable. So thank you very much for your time, Minister.
Ms. Jazik, for 5 minutes.
Thank you so much, Chair, and welcome to the Health Committee, Minister. As you know, of course, Health Canada and the Public Health Agency of Canada have a critical responsibility to protect Canadians by ensuring health products are safe, effective, and of high quality. And certainly at this committee, we have heard many stakeholders say that they want a regulatory system that keeps pace with science and innovation so that new products can reach patients in a timely way. We've heard that there is some effort to modernize some of the regulatory approaches of Health Canada to improve efficiency, but of course while maintaining strong protections for health and safety. So could you detail for us some of the work that Health Canada is doing to speed up some of this regulatory compliance?
Okay. Merci beaucoup.
Thank you very much. What I will say is that, first of all, it's one of my 3 priorities. I'm really putting a lot of time and effort into getting faster approval for new drugs. And we meet almost every week on this one topic with my deputy minister. Currently, we have a big backlog. We've had it since the pandemic. We've almost eliminated this backlog completely. Now we're looking into how we can maybe use approvals already given by like-minded countries so that we can accelerate the approval process. One of the realities that sometimes gets ignored is that everyone wants to go fast, but year on year, the number of requests for new pharmaceuticals is going up. Every year we have more because there are new treatments, new drugs that get to market stage and that need approval from Health Canada. That's part of the question. But we are really making progress in this domain. But it then goes to the provinces, and then only do these new drugs become available to patients. So we're also working with the provinces to see how altogether we can accelerate these approvals.
Thank you very much for that. And of course, you've alluded to the complicated situation where pricing comes into it and the provinces get involved. I was intrigued to see in the supplementary estimates that the Public Health Agency of Canada is requesting $1.5 million for funding government advertising programs. With my public health background, I'm hoping that these advertising programs will allude to various public health maneuvers or suggestions to the public. Have you been through some areas that you think should receive some priority for Health Canada and the Public Health Agency to promote to the public? I'm thinking that there's a certain amount of hesitancy around vaccines and so on. So could you detail some of where this money is going to go?
Oui, c'est sûr que, vous savez, les vaccins.
Well, as you know, scientifically speaking, we know that vaccines save lives. So vaccines are essential. The funding we're providing to the Public Health Agency of Canada, one pillar of it at least is about measles vaccination, because the immunization status for measles has been lost. So we're trying to promote vaccination. And we will soon have, on April 1st, the CPHO who will take office, and we'll try to see with the different organizations how we can get rid of this vaccine hesitation that exists in some communities.
That's it? Okay. Maxime, for 2.5. Correct? Yes.
Merci, Monsieur le Président. Madame la Ministre, j'ai besoin d'être
Thank you, Chair. Madam Minister, you did not want to answer my question. Were you consulted with regard to the closure of the facility of the Canadian Food Inspection Agency's facility in Longueuil? Yes, I was aware, yeah. This facility was the only specialized laboratory in its domain in Canada. Well, we should not fixate on the location. I haven't asked my question, so it's a public health issue here. What other facility will cover the services, given that this facility was the only location in Canada that did some tests and some provided certain services? This is a serious question, Minister. Well, our colleague responded to your question, answered your question. So the work that was done at the facility will not be done elsewhere. The tests have already been sent elsewhere. What's the location? Where did we send the... It depends on the type of test.
And Burnaby, I'd have to verify where the other tests on food allergens were moved to, but the point is the tests were moved elsewhere, so there's no stoppage of work and there's no introduction of any food safety or risks.
Okay. Alors, Madame la Ministre, ce que je comprends, vous me dites...
So, Madam Minister, this facility was closed because others were already doing the same work elsewhere? Is that what you're telling us? Well, the new Liberal government made some choices to see where funds were being spent, and no cuts were made that would put Canadians' health at risk. What I can say is that the operations that were being carried out at this facility were moved to other existing facilities elsewhere. We'll get you the details. Well, here we're finding out that the lab in Longueuil was the only within the Canadian Food Inspection Agency that was specialized in food allergens testing. So I'd like to know how the public opinion can be reassured that the closure of this facility will not reduce the analysis capacity with regards to food safety. That's the question. Well, I was given a guarantee that everything that was being done at this facility, we're going to move that to these two other locations. Can you provide this information in writing to us as well, please? Thank you.
In writing?
Oui.
Thank you. Mr. Strauss, for 5 minutes.
Thank you, Chair. Minister, earlier in your testimony for the committee today, you said that safe consumption sites save lives. Several other Conservative members have spoken to you about this study of what happened after the consumption site at Red Deer, Alberta, was closed. Do you believe that that safe consumption site was saving lives?
Well, I responded to your colleague saying that I was going to look at this study in great detail. This is the first time I'm finding about it. I will read it. I'll look into it. And I've already told you this. All I want is work for the well-being of Canadians.
Consumption sites save lives. These researchers have found that following the closure of the site, there were no lives saved. There was no increase in death.
Quand les gens sont en crise et qu'ils vont mourir, oui, ça sauve des vies.
Well, when people are at the point of dying, yes, these centers save lives. It's clear. I've seen it with my own eyes.
Je ne parle pas de traitement, je dis de sauver des vies
I'm not talking about treatments, but saving lives in the heat of the moment, immediately, yes. And that is why, where this crisis exists in provinces where we have Conservative governments, there
mindedness towards the finding of this study that this particular site was not saving lives. If it was, we would have seen an increase in the death rate when it closed. Could you hypothetically accept that finding once you've read it?
Je vais regarder l'étude avec plaisir.
I will look into the study with great pleasure. We'll analyze it. We'll consult, and I will certainly talk to my counterpart in Alberta because we are open to sharing best practices.
Mindedness is unscientific. It is not open-minded, and I think Canadians will be disappointed to hear that. New topic. Last year, 500,000 Canadians left an emergency room in Canada without seeing a doctor. They were after waiting for hours. My wife was one of them. She almost died. She was bleeding. She was waiting for 6 hours to see a doctor. Our son was 2 days old. I'm very happy that she made it, but many patients and families were not so lucky as my wife and I. Stacey Ross died in Winnipeg. Prashant Sri Kumar died in Edmonton. Alison Holthoff in Nova Scotia. Finley Vanderwerken in Oakville. Adam Burgoyne in Montreal. They all waited hours to see a physician, and after hours of waiting, many of them had not seen one. Over the Christmas break, a friend of mine died. He was in the prime of his life. He was 53. His name was Gord. Paramedics came to see him when his wife called 911. They told him the emerge is chocker block full. You might as well stay here and try again in the morning. And he died over the Christmas break. Mr. Will you acknowledge that this is a crisis and that it's touching every region in our country?
Écoutez, je vous dirais que
Well, I wouldn't call it a crisis, but it is true that our healthcare system is under pressure everywhere. And there are provinces that are doing better, others not so much.
I have an example from each province.
ben, c'est parce que vous n'avez qu'à regarder
Some provinces, because you keep referring to the emergency rooms, if you take it as an indicator, you can take a look across the country and see where
les provinces, j'ai dit, sont sous pression dans leur système.
all provinces are under pressure in terms of the healthcare system.
Well,
Mais je ne dirais pas qu'il y a une crise. Je peux
I
parler.
wouldn't call it a crisis. I see that the system is under pressure.
Seen at CHEO here in Ottawa.
Et vous savez que d'un autre côté, je comprends.
Well, I understand.
You've been minister for a year. I didn't see anything about this in the subs. Do you have a plan to address this problem that is in every province that you're unwilling to call a crisis?
Ben, écoutez, comme vous le savez.
Well, listen, as you know, I work with the provinces and the territories. They are the ones delivering the services in the healthcare system. We are here to support them in terms of their priorities.
Would you agree with me that the federal document, the Canada Health Act, governs the delivery of healthcare in hospitals across Canada?
Nous tous, nous fonctionnons en dessous du chapeau de.
We all function under, of course, the provisions of the Canada Health Act. That's sure.
Regulates the and has special authority under the Canada Health Act. Is that true or not?
The Canada Health Act provides a framework for ensuring that Canadians have a framework on which they have public
Sorry,
health
I asked the
care.
minister if she is the minister who oversees the act, and I'm shocked that she won't take that responsibility. Thank you.
Thank you. Ms. Sadu for 5 minutes.
Thank you, Mr. Chair. Thank you, Minister, and all health officials coming in today. My question is to Minister, I want to talk about AI. It's quickly becoming a key driver of innovation in the healthcare. You have seen on firsthand in Medtronic, some of the technologies being developed, including, we saw how the robot are doing surgeries. There's many other, technologies are developed, which are most recently, is developing everywhere, where the AI and innovation showing the greatest potential to improve patient care and strengthen our health system. Looking ahead, how will the investment in Budget 2025 and proposed Digital Care Act help Canadian innovators and health providers bring these AI-enabled and innovative health solutions to more patient care across the country?
Can you just repeat the question?
So AI on health, like how it will give the good impact on innovation and on the patient care across Canada?
Well, as you said, I just saw it in Medtronic, how AI and technology can change lives. As I said prior to another colleague, I feel from what I see, only what I see on the ground in very few years, the health system will be completely different by using those tools. Yeah. And I think our responsibility right now is to see how we can frame, we need a frame, because right now there's a lot of initiatives on the ground, and when we are talking, for example, about the Connected Care Act that we just put in the Senate, it will help release data, because the thing is, we have a lot of data here. So you have a huge number of data in Canada. But right now, the fact that they are not connected, even on the AI side, the technology, people cannot share, the technology. So when we will pass the bill, it will be even stronger. So we will have like a nationwide.
Thank you. My next question is, clinical trials play a vital role to helping patients access new and innovative therapies, while also supporting research, investment, and better health outcomes here in Canada. Health Canada has announced that it is working to modernize the clinical trials framework to make the system more efficient, more transparent, and better aligned with innovation, while maintaining strong protection than participants. Can you speak the work underway to modernize Canada's clinical trials, mostly or cancer research, why this is so important for the patients and to our health system?
Well, I will turn maybe to you, but I will start maybe, on the regulation and everything.
On the regulatory side, someone else, but I can answer the other parts. For the whole thing to work well, we've lost 3% of market share in Canada related to clinical trials. It doesn't sound like a big deal, but it's $2.5 billion a year and 20,000 jobs. So from an economic perspective, as you said, it's a really big deal for jobs in Canada. And it's the mechanism by which we get drugs and new devices to market. The reason that's a problem is because of all the slowdowns in the system. Part of it is ethics and contracts, which we are responsible for at CIHR. We can modernize all that and speed it up. The other parts are the regulatory frames, with Health Canada is helping with and modernizing and making things faster. There are people in the room who can talk an awful lot more about that than I can. And of course, the other parts are getting the drugs to market once they're approved. I hope that's helpful.
Minister, quickly, if I can ask the dental care plan, one of the most significant expansion, I always got a very good feedback. The family net income under 90,000. How many patients have we enrolled till yet, and what is the outcome for that, and the impact on the families across Canada, if you can speak on that?
Oh,
Very quickly, that's the end of the time, actually. If you
done?
could You're done.
Okay.
Okay, let's go dance for 5 minutes.
Thank you, Chair. I have a question for the minister. I just want, you've heard this question before. One more time, is injecting fentanyl safe? Yes or no? Just yes or no. Oui ou no?
That we have to look into everything. There's no one size fits all in the drug.
So sometimes it is safe and sometimes it isn't? Or is injecting fentanyl safe? That's why I was making it easy with a yes or no answer. It's actually not really very funny because so many people have died.
Well,
at these
and also
injection sites.
This is what science shows also, and this is why those sites were open at a point, and this is why provinces and territories are asking for the exemption that you don't like,
and looking to you as a leader.
Because research shows that it saves lives.
Oh, it's safe.
In Christ, yes.
Research shows injecting fentanyl is safe. Is that what you said?
I am talking about the safe consumption sites. I'm not talking specifically on the fentanyl.
Okay. Minister, when when proposed drug consumption and injection sites come to your desk for exemption requests, do you require an age limit for entry to grant an exemption for these sites? Is there an age limit to get into these sites? Yes or no?
J'ai déjà dit plusieurs fois.
I said this many times before. The provinces and the territories are the ones who deliver these services.
Come to your desk, there's no check mark for the age that can go into these sites. So you agree with whatever the provinces would decide on according to age, because you have the power to shut down these sites if you don't believe in what the services that they're, right? So yes or no, you don't know. Oh, so there is no age limit. Is that what you're saying? No? You don't know. Okay.
I can go ahead and answer that question. So each community varies on the segment of the
That's good to know.
population
Thank you.
that they
Thank you,
are
Ms. Weber.
supporting.
Each community varies. So there are some sites we know that, including the one that you went to visit recently on Hastings Street in Vancouver with your RCMP escort, because
Clarify. It was not an escort.
They were there
No.
to keep you safe.
No.
Oh, they weren't. They were there to give you information about the sites, or?
Do you want me to answer this? So I was with so first of all, I'm working very closely with the Minister of Public Safety and other colleagues, because I think the drug crisis should be an integrated, we should work together.
Okay.
So the Minister of Public Safety, when I went there, I met with the
RCMP
Czar and with the Vancouver police, who is really engaged working with the organization. So I was with them since the morning,
So you were with the police. Okay. But what I wanted to ask you is in these sites, you have to be 16 years old. So I was wondering about do they have to show proof that they're 16? ID. Do they have to show proof that they're 16? Because there are some kids that are 13 that look 16, and there are some kids that are 16 that look 13. Do you have to show ID? Because I would think that it would be very bad for a 13-year-old to be using fentanyl. ID?
Est-ce que vous pensez que c'est parce que...
Well, a young person, a 13-year-old using fentanyl is something very bad. I agree with you on that. But
Question: If a 16-year-old comes in and has never had drugs before, but wants to try drugs, do you have to be a drug addict to have service from this consumption site? Do you have to be a drug addict, or could a kid come in and say, I've been interested in trying this? Do you have to be a drug addict to use these services?
Tout ce que je peux vous dire, nous n'opérons pas ces...
All I can say is that these centers are under the province's responsibility. That's the reality. You keep asking the same questions, so you will hear the same answers.
Thank you.
Thank you. Mr. Esselstyn, for 5 minutes.
All right. Thank you, Chair. I understand the Minister has to leave at 4:30, so I'll respect that if the Minister has to leave. Short of that, but I'll ask what I can. Now, in regards to, I know, Minister, you've been asked the same question again and again and again. Is injecting fentanyl safe, and insisting on a yes or no answer. If I could maybe ask this question: given the choice between injecting fentanyl in a supervised consumption site or injecting it, behind a dumpster in a back alley, which of the two options is safer?
You're still injecting it. That is the stupidest thing I've heard.
Oh my God. Well, I think it's clear that the supervised consumption sites were opened with the objective of saving lives. They save lives. It's clear. There's no discussion on that. people who are doing an overdose, for instance, yeah, in that case, these centers save lives. It's not a treatment, but it saves lives. It allows the people to stay alive.
And in regards to when they talk about with the questions coming up about this one study, I've looked at the study. It is, first of all, a single study of a single center. Even the authors themselves said, in order to make a conclusion whether this closure changed the number of lives saved, that due to the insufficient follow-up time, that the results were inconclusive. So do you think we should be completely changing our approach to this problem based on one study of one center that the authors themselves say is inconclusive?
Écoutez, honnêtement, je ne vais pas me prononcer parce que je vais prendre l'étude.
Well, honestly, I'm not going to speak to that right now. We will take the study. We will look into it at great detail, study it with the department. But, as I said, I want to solve this crisis. And as I've also said that, we can work in prevention, treatment, and also do this because we have to save lives. People who are in a crisis situation, we have to save their lives. I will look at this study in detail, and I'm ready to come back with our colleagues to discuss.
All right, thank you. If I have time for one more before you have to leave, we have been talking about emergency wait times and the Canada Health Act. Now, I've worked in emergency during the times that we've seen these increasing wait times. During that time, I know that the federal government gave record high federal health transfers. However, under the Canada Health Act, is there any provision that the federal health minister can say to the provinces, you must spend this money here? Or is it purely a provincial decision how that money is spent and how the programs are run, like funding emergency departments? Is that not the decision of the provinces under the Canada Health Act?
Oh, c'est ça. Non. Donc, dans les transferts en santé, on fait les transferts.
We do the transfers, but after it's the provinces who make the decision as to where they spend the money. I mean, do they want to spend more in their hospitals, more in primary care? It really is up to the provinces, and it varies from province to province. So that's the federation for you.
Thank you, Minister, and I believe that's time.
No, it's not. We had a minute left, but 2.5 minutes, Mr. Maxine, go ahead. 2.5 minutes.
Oui, merci beaucoup.
The Minister has to leave at 4:30.
Well, we started about 3 minutes late, and that'll put us within 59 minutes. So.
Merci beaucoup, Monsieur le Président. Madame la Ministre, avant de
Point of
vous laisser
order.
partir à vos occupations.
Point of order.
You don't have 2.5 minutes for Mr. Blanchet?
This is what I want to say. I was not late. I was on time. Okay. Maxime?
Go ahead.
Oui, okay.
Yep.
Merci beaucoup.
Did she just try and point of
Okay,
order
thank you very
herself?
much, Madam Minister.
Point of order.
I'll try to not to keep you here for too long, but on March 9th, you made an announcement about an improvement in services in sexual and reproductive healthcare services. But, as you were saying, the federal government is not in charge of delivering services to Canadians. So I'd like to understand how you can make investments to improve these services if you are saying that you're not in charge of that. The question is for you, Madam Minister. Well, yes, I made the announcement, so I will speak to it. These are not direct services. I will give you an example. We funded the Society of Gynecologists so that they could build guidelines. We have projects that provide information to women with regard to their right to abortion, etc. So there are many projects to share information, to raise awareness. That's what we announced. Well, Madam Minister, you seem to be funding associations in an area that is provincial jurisdiction, so that's not interference? No, not at all. I worked really well with my counterpart from Quebec. As you know, if we were to make announcements in Quebec, we would need to talk to them, of course. But you are funding organizations and healthcare services, so that's skipping over, if you will, the jurisdiction of provinces. So what can the federal government do better than Quebec when it comes to funding investments into programs about sexual health? So why would you not improve the healthcare transfers and do this instead? Well, first of all, it was in our election platform, so this was a political move. No, because there are real needs as well. While you referred to Quebec specifically, I made the announcement in Quebec, but I did that with Quebec's full agreement. Well, you made the announcement in Quebec that there will be a partial election in Terrebonne in Quebec. That's a coincidence? Really? Well, we make an announcement in Montreal, and you're saying that that's in connection with Terrebonne? Well, it's a coincidence, don't you think so?
Thank you very much, Minister. With that, thank you for spending the hour and a little bit, 2.5 minutes. But that was good. While you leave, we have some committee business to do. We have supplemental estimates to pass. So I'm wondering if I could have unanimous consent that we pass these supplement estimates.
Okay. So that was it for the hour. We're not going to stay for the second hour of this. He's going to suspend right now anyway while the minister leaves. And there isn't really anything else really for us to tune into besides that. Most of the other committees are in camera. And any ones that aren't don't really have much going on. So we'll just call it here. Yeah. I'm still mind boggled by that Lib MP's question. If you inject it behind a garbage can, or we do it for you, which one's worse? Oh my. Oh. You can't make that stuff up, man. 60 minutes of dodging a simple question? Yeah, exactly. This whole meeting was messed? Yep. But yeah, like I said in chat, guys, the house is off next week. So we literally have 10 days or whatever until there's a next stream, which will be Monday the 23rd. So yeah, 11 days. Yeah, I will get clips out on the channel that as stuff happens next week. So feel free to tune back in. It'll always be at the top playlist, the Stay Informed playlist. And yeah, that's it for this week, guys. Hope everybody has a good weekend. Thanks everyone for tuning in and watching. This week has been a lot. Need to recover. Yeah, it was a pretty packed week, to be honest. I feel like whenever Parliament takes a break and then we come back, there's just a lot happening at once. So, yep. Okay, I will leave it here, guys. Bye, guys. Have a good evening, guys. See you.